So a question I get all the time is, well, can I just get a tank of oxygen and a mask and just breathe the oxygen while sitting on my couch and watching TV? Well, unfortunately, in order to extract the benefits that hyperbaric is truly capable of, it is the pressurized environment, even more so than the percentage of oxygen, that makes that possible. In today's video, that's exactly what we're going to be talking about. What are the differences between breathing oxygen at the surface, outside of a chamber, versus breathing oxygen inside a pressurized environment? Hi, I'm Dr. Jason Saunders. I've been practicing hyperbaric medicine for over 20 years. We've treated thousands of patients inside of our clinics, and we've trained and certified over 1,000 different people in hyperbaric medicine, both clinicians and technicians all over the world. Today, we're talking about the difference between breathing oxygen at surface pressures or outside of a hyperbaric chamber, like on your couch, versus breathing oxygen inside of a hyperbaric chamber. First, we need to understand that if you live on planet Earth has a pressure. So technically, we are all already inside of a pressurized environment. The atmosphere has a pressure associated with it. The pressure of that atmosphere is the reason why even right now, while you're listening to this video and you're breathing, you're able to extract oxygen out of the air and drive it into circulation. If you live at elevation or if you live at sea level, there are different pressures associated with those different regions. The closer you are to the Earth's surface, as in at sea level, the higher the pressure is. And the higher you go up in elevation, the lower the pressure is. That's why if you ever went for a hike, let's say on a mountain, it feels harder to breathe because there's less driving force pushing oxygen from the air you're breathing into your circulation versus at sea level, where the pressure is sufficient to saturate your red blood cells 100%. What do I mean? Well, if you've ever had a pulse oximeter put on your finger, it's measuring typically your resting heart rate, and it's measuring your red blood cell oxygen saturation. For most of us, if you have healthy lungs, a healthy heart, and a healthy circulatory system, then you put a pulse oximeter on your finger, you should get a reading of 97 to 99 or 100%, meaning you're carrying almost as much oxygen as your body's capable of carrying. Perhaps if you have issues with your lungs, your heart, or your circulation, that number may be lower. While a pulse oximeter is not measuring a quantity of oxygen, it is giving you an idea of percentage-wise, how much oxygen are your red blood cells carrying compared to what they're capable of. 100% would be the maximum capacity, and you're at some percentage less than that. So what's the difference between breathing oxygen at the Earth's surface versus inside of a hyperbaric chamber? It's really how that oxygen is being carried inside your body. If we stay only under atmospheric pressure, regardless of where you happen to live, and we get you a tank of oxygen and a mask, and you're sitting on your couch and you're watching TV and you're breathing 100% oxygen, we should certainly be able to get you pretty close to 100% saturation, if not 100% saturated. Whether that means you're healthy and you're 97, 98% already, and now we're getting you another 2 or 3%, or you have some sort of issue, you're 88%, 90% saturated, but we're still driving you into higher percentages closer to that 100% capacity. But as you can imagine, we could never be more than 100% saturated with anything. So once we hit 100% saturation, that is your max oxygen carrying capacity. How does that differ from being inside of a hyperbaric chamber? Inside a hyperbaric chamber, you are now pressurizing the air or pressurizing the oxygen that you're being exposed to. With a pressurized environment, you are now able to drive exponentially higher levels of oxygen into the body based on 3 variables: how much pressure you're being exposed to, what percentage of oxygen you're breathing, and of course, how much time you're spending in there. Are we saturating red blood cells? Certainly. The same way you would if you were breathing oxygen at the surface. But inside the chamber, what you're really doing now is bypassing red blood cell carrying capacity altogether. There's 2 portions to your blood, a cellular portion and a liquid portion. The red blood cells make up the overwhelming majority of the cellular portion, and the rest is plasma. The liquid portion of your blood, plasma, typically, like right now, assuming you're not in a hyperbaric chamber while you're watching this, carries very little oxygen. 98% of all the oxygen being carried in your body is bound to a red blood cell. Very little is free floating in the plasma. When you go into a hyperbaric chamber, once the red blood cells are fully saturated, whatever amount of oxygen you're being exposed to, and once the red blood cells are totally saturated, all of the remaining oxygen is going into the plasma portion of your blood. So this liquid, which typically carries very little oxygen, becomes a reservoir of almost unlimited carrying capacity, again, based on those same three variables: pressure, percentage of oxygen, and time. Inside that environment, and with all of that additional oxygen, your body now has the capacity to do things that under normal circumstances would be impossible. The rate of ATP production, or the rate of cellular energy production that occurs because of that huge increase in oxygen, is just literally impossible unless you're in that hyperbaric chamber. The same part of your cell that makes the energy, the mitochondria, is going to grow in size and literally multiply in density as a result of repetitive hyperbaric oxygen exposures, meaning you're going to have larger mitochondria and a greater number of mitochondria, creating even higher levels of ATP as a result of those exposures. This is only possible because of the pressurized environment. This would not happen just breathing oxygen at the surface. In addition to the energy production benefits, there's a range of other reasons that people use hyperbaric: immune system stimulation, inflammation control, metabolic changes, and then cellular repair and regeneration. It's really due to the ebb and flow of oxygen exposures, specifically from a chamber environment, carrying exponentially higher levels of oxygen, coming back to normal, being exposed to exponentially higher levels of oxygen, coming back to normal, and repeating that over time, creating this wave of increased oxygen back to normal, increased oxygen back to normal. It's that journey that's really shifting the body and making all of the regenerative and immunological and metabolic changes possible. Is there a benefit to breathing oxygen at the surface? Absolutely. Are those going to be the same benefits as breathing oxygen in a pressurized environment? Unfortunately not. I think it's important to note that a lot of people aren't really breathing as well as they could be. Most people are in a fight or flight state. Most people take shallow chest breaths. Learning how to breathe properly, learning how to breathe from your diaphragm, not from your chest and neck, learning how to do breath work and making that part of your overall health and wellness practice is incredibly important. And to do that would certainly improve a lot of the systems inside of your body. And I think all of us need to be doing that. As incredibly beneficial as breathing normally is, and as incredibly beneficial as breath work is, those practices and those benefits are just vastly different from what you're getting in a hyperbaric chamber. And as a result, they really shouldn't even be compared to one another. Depending on whatever your health issues might be, and depending on whatever your health goals are at this time, perhaps the most important thing to do is to learn how to breathe and to do breath work. Or perhaps the most important thing to do would be expose yourself to some hyperbaric sessions to gain those benefits. But the main point here is that neither one is really a substitute for the other. Their practices and their benefits are independent. If some of these concepts are new to you and you're looking for ways to learn more about hyperbaric oxygen, first, I've gotten hundreds of videos here on YouTube. Please feel free to look around and continue to learn. I've also written 2 books on hyperbaric oxygen, one for practitioners, The Art and Science of Hyperbaric Medicine, and another one for the general public, Oxygen Under Pressure. Both of these books provide a tremendous amount of additional information around what hyperbaric oxygen is, how it works, and really what makes it so unique. So if either of those books are of interest to you, we'll put links to the books in the description below. Thanks as always for your time and attention, and I look forward to seeing you on the next video.